Hi, and welcome to the 2-Minute Warner. I'm your host, Perry Busby. The 2-Minute Warner is brought to you by the Westside Gazette newspaper, one of South Florida's oldest African-American-owned newspapers. And joining me is my co-host, the publisher of Westside Gazette, Mr. Bobby Henry. Bobby, how you doing, my brother?
You kill me, man. You kill me. I
What? Because I don't sound like Florida, South Florida?
No. That too, but no. Seriously. You know, and I'm sure if I had an opportunity to introduce you first, you probably would feel the same way because I would say some encouraging things about you.
Right.
And that's always appealing. But Perry, I am terrific at getting better, truly.
Yeah. You know, now I always like these intros because we never know how we're gonna come to you. So
no. And, you know, this is a living format.
That's right. That's right.
What do you expect? But no, man, I don't know about you, but the January 6th, what do you call them? Hearing
select committee. Yeah.
So what's your take on that, man?
Just what, the hearing or just the whole thing?
Just give it to me in a capsule.
Up to this point. I mean, I guess I want to reserve any thoughts on the hearing because I think they're kind of obvious at this point. But I do think that if those who were pulling the levers behind this are not held accountable, then it's going to be hard even, I mean, the ripple effect could be hard. It would be hard. Would you pay a speeding ticket if you thought you wouldn't speed?
No.
I mean, I'm just saying,
But you also we were talking and you were telling me, I forgot what you were saying about when we were discussing the hearing. How you were saying, Perry.
We talk so much.
I know we did, but no, you said something that was really profound when it came to what we expected, and I guess you just summed it up with that.
Yeah. I think the expectations are there. It's and I know everyone keeps talking about we're in a new area where we've never had the where a president has never come this far.
Coming this far
in terms of being being prosecuted and just not just the president but those within Congress. Mm-hmm. And it says a lot. I think our country sometimes tends to think that we're too dignified to be as dirty as we are.
Ooh, what did Frederick Douglass say? What do I or those I represent have to do with your national independence?
Right. And
he also went as far as to say that the atrocities that this country has portrayed against people who look like us, compared to anybody else, it would be barbaric.
Yeah. I mean, from Nat Turner to someone said if that January 6th riot had been ISIS back, would we feel the same way? Would we have such a nonchalant? And I think that's a critical question. That when you are wrong, I mean, how do we teach those in power that when they misuse their power, what is the recourse then?
Mm-hmm. And I want the listening audience to understand that, we're not racist. And we got to get that point across. We're not racist. It's just that if you took a look at American history and be it, if you read about it, if you see it from film, you would see where those who have been oppressed and have not had a voice or their voice has been muffled purposely, then you would understand our reasons when we do talk boldly about certain issues, it come across as if we might be one-sided, but we're not.
Yeah. No, and I would also say to that also in our history, we do know that those, whether we call them the oligarchy or those within the top 1%, have always used poor white men to exact justice. It shows that through history. Poor white men have always been the one that's always been at the forefront of riots. And they're used by rich white men because they don't want to get their hands dirty. But that's not me. That's history saying that. That's history saying that.
Could it be that's the reason why certain entities might not want the true history taught in our educational system?
Yeah. You mean that CRT?
That's a part of it. Oh, man, but you
race.
No. You were not a slave.
No, I was involuntary displaced, or what? That's what they saying in my old hometown. Yeah, involuntary displaced.
But and then one guy said they love their slaves. They were like family. Okay. But we got a very interesting show tonight. We got two. Maybe hopefully Miss Chrispin shows up. She has been stressed out in her field of endeavors, and so she is supposed to be here, and hopefully she'll show up. However, we still have two interesting guests, and I know one particular guest, Miss Jennifer King, who has been on the forefront of the war and fight against HIV and AIDS and other malfeasance that may present itself with people who are living with AIDS or just not happen to be, but are in that area. I know late 70s, early 80s, we heard a lot about HIV and AIDS, and since other things have come up, COVID and monkeypox and other things, we might think that the fight against HIV and AIDS is dead, but it's not. So let me do this. Can I introduce our first guest? Sure. Okay. Sure. And I like to introduce a warrior, a staunch stand-up person who has thrown herself into the fray, into the mix of this fight against HIV and AIDS, and the citizens, the people, the clients, the family members who are caught up in this system. She has been on the forefront fighting. She herself has a fantastic story from her struggles. So if we can, and you can read about her further in the Westside Gazette, but let's bring on Nurse Jennifer King. Good evening, Miss King.
Good evening.
Good evening, Mr. Henry. Nice to see you again. I hope you remember the face.
How are you?
I have to tell you, sir, I don't hear you very well at all.
Okay. Brother, can you adjust the sound? Okay, how about now, Miss King?
No, I mean, I listened to what you were saying about the insurrection. I had to actually put my phone to my ear in order to hear the very interesting commentary between the two of you. But I don't hear you. I don't know how. I mean, I can take the phone and put it to my ear and listen to what you want me to say and then show you my face. But this is your live show, and I want it to actually go well.
It's going well. You know, anytime we have an opportunity.
So I'm gonna put my ear more to the phone so I can hear you.
Yeah.
Oh, so you're on the phone. Okay.
Yes, because I was not told that I needed my laptop, and I left it at work.
Okay. Then I'll be quiet and we'll let you talk because we can hear you quite well.
Put a phone speaker.
Well, can you tell me what would you like for me to talk about? Would you like for me to talk about me as a nurse, or the company I work for that I started working for 21 years ago?
Okay. Now, do you have your phone on speaker?
Um, I am on your. It looks like a Zoom call, and I only have control over the mic. I can mute it or the cam. But
Yeah.
no, I'm actually on your website of your what's going on here today.
Okay. Okay.
Okay, no
Okay.
problem.
Mhm.
Let's go with it.
Okay. Let's start off first. Let's start off first by introducing you. Tell us a little bit about you and some of the struggles that you went through becoming a nurse.
Okay, so now I know you read the article. So I'm Jennifer King. I was born and raised in Miami, actually born in Mount Sinai Hospital in 1957. Talk about racism. My mother worked for Jews, and that's the only way her baby was born there. I went to the schools there. I grew up in what was Carroll City at the time, which is now Miami Gardens. And my mother owned a home there for 50 years before she passed away, and I now reside in Miramar. At the time that I was going to school to become a registered nurse, which I am now for a while, I went through some breast cancer, but I refused to stop going to school. I told your reporter, I even found it kind of strange that I found some type of strength to not give up and to keep going. And after that, I passed through that. I was taking care of my mother with Alzheimer's. She had retired from the great South Florida State Hospital. I know you know where that is. She worked there for 34 years. And I saw an ad in the Miami Herald, which no longer exists, as you know, and it wanted nurses to work in Miami-Dade and Broward in a program to capture people with HIV and AIDS that were not in care. The state of Florida had no record of medications and no record of health care. And the zip code that I believe you're in, 33311, was the highest. I had a caseload there of about 285 patients. So the program was designed for us to actually go door to door to the patients on our rosters, introduce ourselves as someone, as a comrade, not someone to report if they were doing drugs or whatever they were doing. I was there to help them to get into care. The struggle started then because at that time, we're talking 2001, people, African Americans in Broward County, where I worked, were just very, very reluctant to go to any doctor or to take any kind of medication. That was a huge struggle. I put people in my car. I found out what bus routes they're on. I haven't been on a bus in God knows when. But something told me I needed to advocate for the people like myself because I could go to the level of understanding that everybody has differently, and we know that even today. Some are educated, some are not, some are poor, some live on the fringes, some just want a handout. But the bottom line was healthcare. I found a lot of them going to doctors that never treated HIV. They were giving them the wrong medicines. So we were able to gather these people, herd them into care on a grand scale. I'm very proud of that. That happened for about 9 years. And then AHF, which is known as AIDS Healthcare Foundation, needed a funding source because they are a not for profit. And the funding source they came up with in California was to put pharmacies in their clinics. So I suppose they got all the licensure and everything that was needed. And they came to me, of all people, said, "We want you to become a marketer of our pharmacy service and market it to the patients that you have, that they don't have to leave their homes or do anything. We'll get the prescriptions from their doctors, deliver their medicines to their homes week after week, whatever, month after month, no matter what." I kind of thought it was awkward because my first words were, "I'm a nurse, registered nurse now." I'm not a marketer. I know nothing about marketing. But then again, there comes that voice in my head. You must try, because my vision was to help people with HIV and AIDS. So that is what I currently do. But I took on another position unilaterally to the marketing position. AIDS Healthcare Foundation has a Medicare plan. So when people turn 65 or they have disability and now they're going to get Medicare, it's my job to capture them to the Medicare plan because it offers more services than, and I won't call the names of the other Medicare plans. So I was asked to go and get a license to be a Medicare sales agent. So I have really shot into heaven as to what I'm doing for a living. It's kind of shocking, but it is the most rewarding job I've ever had.
Mhm. I know pertaining to statistics and where is 33311 now, if you will, or Broward County, as it relates to HIV and AIDS?
Because I work so hard, I haven't kept up with statistics. We've been in a COVID, we're still in a COVID environment. I don't know the numbers. I don't know if Ebony will come on because she's our legislative affairs person, and perhaps she could better answer that question for you, Mr. Henry.
Mhm. Mhm. Okay, okay, okay.
Well, yeah, I guess in terms of statistics, but in terms of medical costs, I know that a lot of the prescriptions have come down. What is the affordability and how uh, uh, are there? I'm sure there are still disparities, but how does that tend to help those within underserved communities in terms of access to adequate uh, prescriptions as well as the cost?
Well, let's not go with prescriptions right away. Let's talk about just getting them in the door. As you
Okay.
know, many poor people, they have a poor health history. Many poor people won't even go and get tested for HIV, let alone let someone grab their hand and walk them into care. So the biggest obstacle is getting people to first be tested, and next, if they test positive, to bring them into care. So the AIDS Healthcare Foundation has done a miraculous job of closing the loop when they test patients either on the van or wherever. If they just walk into one of our wellness clinics, they are walked into care right away. They are introduced to someone in our department that we have called linkage to care. That person finds out, what's the level of understanding that the person has. They deal with the fears of them first maybe just finding out they're even HIV positive, and they advise them to get into care, but you have to work with people at their level. So getting them into care, once they come into the clinic, then I'm there. I'm now responsible for 3 clinics in Miami. I'm no longer in Broward at all. We have a clinic on 54th Street that I can pat myself on the back. Then I begged this organization to put a clinic in Liberty City, in the heart of Liberty City. And it got done by 2019. Praise God. We have another location at Biscayne and 24th, which is a open door 6 days a week of just doing testing of all sorts. But once we get someone into care who wants to come into care, the ability to pay is the last resort for the AIDS Healthcare Foundation because their mission says cutting edge medicine regardless of your ability to pay, so they don't have that worry. If they have no insurance, there are nurses and other staff that are on board to see if they qualify for Medicaid, to see if they qualify for Obamacare. And if those things aren't available and they don't qualify for Medicare, then they're put into Ryan White. I don't know if you know about the Ryan White Care Act or the the kid Ryan White with hemophilia, but that came through. I think it's partly funded by the feds and then the states. So that is the pay of last resort for people with HIV. So there is no reason why anybody should be afraid of cost or drugs if they come to the AIDS Healthcare Foundation. If we have to pay for it in advance for 2 and 3 months, AIDS Healthcare Foundation absorbs the cost. But it's not so much the drugs initially, it's the labs because you can't just give people medication when you don't know what their status is blood wise. I hope you understand what I'm saying. So that in itself is very expensive, and this company absorbs that cost. But then again, they're 501c3, and what are they to do? Take care of the people that they serve.
Okay, now, Ms. King, you said that you're no longer here in Broward. Are you familiar with any of the services or where someone in Broward could receive those services? And before you leave, we need you to give us your number that folk can reach out and contact you.
Absolutely. I'm kind of like the one-stop shopper because I'm basically the historian of AHF in Dade and Broward County in South Florida, period. So I would be more than willing to give you my number, give it to your listeners, and even though I work now in Miami-Dade, I can I can direct them and put them into care without a runaround. That is what we never want, is for patients to hang up and have to call another number. That won't happen. You could give them my direct number and let me know when you're ready.
Go ahead. Go ahead.
It's 954-415-8687.
Okay.
And if I don't answer right away, that means I may be with a patient. Please leave a message. I call everyone all the time.
Ms. King, if there is one important thing that you would like to say to this listening viewing audience, what would that be?
It would be to ask everyone to get tested. It's 1 minute rapid test. You can go to many places. If they don't know, they can call me. But AHF is everywhere. In Dade, Broward, and Palm Beach County. Get tested because knowing your status means that you get to protect yourself and the public at large.
Okay. Ms. King, don't go anywhere. Hold on right there. Our next guest, he's in a parking lot with his battery dying, and we really want to hear from him. Judge, can you got any juice left?
I have a little bit of juice. Fred Seraphin, so happy you got. I'm sorry, I rushed out to come down South Dade to attend a meeting. You know, I'm running around campaigning, and I forgot my charger my at home. Thank you so much for having me, though, and thank you, Ms. King, for letting me jump in there.
Hey, Judge, can you give us a little bit more volume?
Sure, maybe I can come closer. Is this better? Maybe I can. How about now?
Can you hear that?
Yeah, I do not control my microphone volume, I'm afraid.
Good, you're good.
Good? All right.
Yeah, you good.
All right, I'll try to put the camera up here. Well, thank you, gentlemen. I am honored to be with you guys.
No, Jeff, you're good. Let me do this, Jeff. For those who don't know this gentleman here, he too has a very interesting story. And Judge, I know your battery is dying, and I know there's certain things we can't ask you, but give us your name and the position you're running for. But give us a little bit of that interesting history. Bring it on, Sapase. Come on, talk to us, Judge.
Mr. Harry, the thing is that I committed my life to serving the public in 1982 after I was arrested for an armed robbery I didn't commit in Kings County, Brooklyn, which I grew up in New York. I was born in Haiti. I like to tell people that I'm a victim of injustice who committed his life, half my life now, 36 years, to serving the cause of justice. I made a commitment on my way to law school when I got arrested. I was at City College in New York, got arrested, then I committed my life then to the public defender's office because I had a legal aid lawyer help me represent me in the charge. Grand jury returned no true bill. I got into law school. I thank God for it because He paid my law school too, and I realized that was my mission. But the only thing is, I asked God, well, did you have to show my calling in that way? I had to sleep in jail, get arrested, put handcuffs on, and be scared like that. He says, yeah, that's the way it rolls. You know, I was born in Haiti, and my
Okay.
dad, my family opposed the dictators, both Papa Doc and Baby Doc. So by the time I was 11 months old, uh, Papa Doc came and took my dad because he fought for freedom. He stood up against the dictatorship, the tyrant. He stood up for journalists, and he was a congressman, I guess we'll call it. In Haiti, it's called a député. So at 11 months old, they came and got him. I had a brother that was a political prisoner for 5.5 years in Haiti under Baby Doc, the son now. So I see that was my calling in that I had to work to protect people's constitutional rights. I started working at the public defender's office in Miami-Dade County. They came to New York. I had an interview with them, came down here. They offered me the job. So I graduated from law school and we moved down here right away. My wife and my baby, thank God they put up with me all this time for 36 years. I was a lawyer for 15 years. In 2001, I applied for a position. There was a vacancy, and Governor Jeb Bush saw that I was the best qualified candidate, and he appointed me then. I've been reelected over and over again, and now I'm trying to serve one more term. I still have the fire burning in me. I help people every day get their lives together, get their lives on the right track. And now I'm hoping that the fine residents, citizens, voters of Miami-Dade County will allow me to serve them again for another 6 years. So that's the journey in brief. Can't give you all that powerful emotion that I feel every time I tell that story, but it is a very good, I'd say, honor, privilege for me to have served the cause of justice. We know what it is. We know how hard it is for us to get it. And I am privileged to be able to serve it every day when I go to work and try to help people because I've been a victim of injustice. So hey, you understand, right, Mr. Busby, that, hey, I do what's right, regardless of the consequences. I always say I make a decision not because I'm afraid of losing my job, but because it is the right decision to make. So it's been my guiding light. Thank God so far. It's worked well for me.
And Judge, for those of our listeners who may not know, are you in criminal court or civil court, and also what court numbers so that our voters will know what to look for?
Well, I am in a hybrid. When I first started, I was in civil court. I was over at the Caleb Center back then, and I did everything because I was the only full-time judge there. Then I went to criminal court because that's what I love. It's criminal court where I get to work with the young lawyers that are coming in, and I get to mentor them and try to instill in them the value of their purpose, their work in the criminal court in protecting people's rights, both the state and the public defenders and defense lawyers. And I get cards from them thanking me for mentoring them and teaching them. So right now I'm in a hybrid. Right now I do domestic violence. They call that's my circuit court role because I do civil injunctions. And then I do criminal court misdemeanors over at the North Dade Justice Center. So it's awesome. Well, thank you, Vanessa Woodward Byers. She says Judge Seraphin is the best. I agree with that.
I know, I'm sure you would. And coming from Vanessa FAMU Rattler Byers is one of the best. So if she's giving you those kudos, Judge, then you must have earned them because Vanessa wouldn't just say something.
Well, you know, I take pride in my work. I take justice very seriously. And that's, you know, a writer once wrote, a journalist wrote that to understand justice, it helps to know injustice. And that's my approach to it. I've been there. I went to court. I don't know if you guys ever heard of Judge Bruce Wright in New York. They used to make fun of him and call him Cut Him Loose Bruce because he applied the bail laws the right way. And I had the good fortune of appearing in front of him. And you guys heard of Khalif Broder, I'm sure, the young man who was locked up at Rikers Island. And I knew some people from Rikers Island, so I didn't want to go there. And that judge was kind enough, Judge Bruce Wright, to let me go home and come back with a bail of $250. So, yeah, I take this job that I do super seriously. I don't apologize to anyone because of the decision I make, because I know they can reverse me if I'm wrong. But I try my best to make sure that I'm up to date on the law. I listen to the people who come to present their cases. I'm super patient with everyone. I'm super respectful. My motto is to be fair, compassionate, and experienced. I don't take it for granted that I am a good. God has blessed me tremendously coming from Haiti, growing up without a dad, growing up with my mother. She's a strong woman, powerful woman. She raised 7 kids. After Duvalier killed my dad, I was the baby, of course, because I was 11 months old. And I have 4 sisters. So they're my village. They're the ones who shaped me up, kept me going, provided for me the little bit that we had. And God provided the rest for me to go to law school. So, yes, I do this work with passion. I went to county court, misdemeanor court. I never tried to leave there because that's the people's court. You guys know that, gentlemen know that most people who go to county court don't have lawyers. So I'm there to try to explain the best I can what's going on, the best I can how to access our justice system, and give everybody a chance to be heard. And when they leave there, I may not have ruled in their favor, but my goal is to make sure they understand that I listen to them and that I apply the law in a very fair and impartial manner. And so far, 20 years on the bench, I thank God that I think I've done a good job. And otherwise, I wouldn't be asking people to vote for me again. The number is 99. This election coming up, people tend to neglect judges. I suggest we don't do that because judges make decisions that affect your life right away. Can I share this brief story with you? I had a young man send me an email and he wanted me to swear him into the bar. And his message to me was, he wants me to swear him in because he had a case with me 10 years ago. And because of the impact I had on his life, he went to law school and he's becoming a lawyer now. And he had his clearance from the bar. So he asked me if I would swear him into the bar. So that meant the world to me, making a difference in young people's lives every day, trying to talk to them. And thank God that I have been able to get some very positive results. And that young man's note to me, that sealed the deal for me to run again. It says, yes, I can keep making a difference. I have the passion, I have the energy. And that explains why I am here and I'm running again for office all over Miami-Dade County. I'm running.
Okay, Judge, we can tell that your battery is going because your voice is starting to break up. So let's leave on a good note. How can we get in contact with you, and what can we do to help you?
We have to get out the vote. We got to come out in large numbers. We can't neglect the fact that, ignore the fact that we need good judges on the bench. I put myself out there as a candidate, say that I am. So I can be gotten in contact with Judge Seraphin.com, JudgeFredSeraphin.com. That's my website. You get more information there, and you can leave a message. I'll get back to you.
Okay, Judge, thank you so very much for joining us. And as the old folks say, I want to lay my eyes on you. I want to get a chance to have a conversation with you. And thank you so very much. Yes, sir.
I'm looking forward to it. Thank you. God bless you. God keep you. Good night, everyone. God bless you all.
God bless you too, and stay safe.
Thank you so much.
Okay, Miss King. I see Miss Chrispin hasn't joined us yet, so we're gonna put all the weight on you. You ready?
I'm gonna fight a good fight.
Right on. So also, Miss King, you mentioned the fact that COVID has caused, I don't know how do I say this, some I won't say delays in service, but has commanded a lot of attention. How has that affected the severity or the need to deal with the HIV and AIDS epidemic?
Well, I'm glad you asked that question because I've been tasked almost a year now with helping to find some 8,000 patients lost to care during COVID. And I almost wanted to cry when the judge said this gentleman wanted him to officiate him in the bar, because I did call a gentleman yesterday who had been coming to our clinics very readily and got sick with COVID. I was able to speak with him yesterday. He tried to disguise his voice. I didn't know. And then he said, "Oh, Miss Jennifer." I said, "Yeah, Jennifer King." "Oh my God." He started to cry. He says, "I haven't been in care for a year. I'm just afraid. I haven't been vaccinated and I'm scared." And I said, "Well, have you been taking medicines?" "No, no, ma'am, I haven't had any medicine." I said, "But I thought we had a really good relationship." Probably about 6 years he's been coming to our clinic with Dr. Deborah Holmes, who, thank you. You interviewed her, I'm sure. Wonderful woman. Um, and I said to him, "Why didn't you just call me?" "Well, I lost your number." And he said, "To be honest, I've just been depressed." And I wanted to cry. It's that kind of situation right now with the patients we're trying to find. A lot of them had died, Mr. Henry. And when I speak to family members, I have to document that so we can go on the record. We have to clean up our database after COVID. But nobody has known really how to do this COVID, other than the people like you all today with this Zoom on the telephone and Zoom everywhere. I am just grateful for something from COVID, at least Zoom. And it's not good. I have to be honest with you. People are afraid. People are out of care. They're not on any medicines and they're not in care anywhere. And on the front lines with other nurses, we're feverishly trying to find our patients. If that answers your question, I hope.
But you're doing a good job. Miss King, your camera is only showing the top of your head. There you
Okay,
go. Now, let me
okay.
see the view.
Remember, I can hardly hear you. So when I
Okay,
move the camera, that's because I'm putting the part
okay, all right,
where
all
you
right.
talk
I
to my
see.
ear like this. Then I'm moving the camera back when I talk. I'm so
Okay,
sorry.
that's quite all right. One of our viewers from over in Lewiston, Miss Jeanette Taylor. Now, at one time, I know that area over there was one of the number one areas that was infected with HIV and AIDS.
Mhm.
Does your outreach go that far?
Well, you're talking about in Belgrade, am I correct?
Belle Glade close area, the Glades, yes.
When I first started with AHF, they had a van outfitted like a clinic, and they had nurse practitioners working the clinic. But the fear and doubt in Belgrade was great because I went there a couple of times, not on the van, but I went to the health department there so I could try to connect with the people in the health department who said people in Belgrade don't want anybody to know that they're positive. So their care numbers were very low. We're talking probably 2004, 5, 6, something like that. Since I'm doing so many things now, I've not revisited Belgrade at all, or Clewiston. So I'm not real sure if they've come on board. AHF has moved into Palm Beach County, which I think that's the same county. But people have to want to do this. Let me just give you a true story because it's coming up for school. I partnered with a church in Homestead in a very low area of Homestead with a woman who was a police officer for the city of Sweetwater. I think this was her church. And she said, "Can we do a book bag giveaway? Can you sponsor it?" I said, "Absolutely." I got permission from my superiors to spend whatever dollar amount I needed to buy 100 book bags for boys and girls and to outfit the book bag with everything I could, from paper to folders to pens to scissor to crayons, whatever was needed. We packed all of them. But what is really I want you to hear, we started 6 weeks in advance. We put the flyer in stores, gas stations. We gave them out by hand. The church was very diligent to make sure that it was well represented. I'm friends with the host of the was not Tom Joyner anymore, Rodney Baltimore. He had me on to, give information because he does public things that's going on for the public, for the health of the public. So he ran it that Thursday and Friday. We had it on a Saturday. It was not very well visited. So the church and their members went door to door, begging people, come, get just a 1 minute test. Let them stick your finger. And this lady is going to give book bags to however many children you have, 5, 6, or 7. It doesn't matter. One adult, all the kids get a book bag. And it was not well received at all. My thought at the time was, just as we have fears about the Tuskegee studies and any other fears that African Americans coming over here in slave ships have, it is in the bloodline and in the DNA. Black people wait until they're nearly dead before they go for care. This is a truth that we Black people don't talk about often enough. We have to find a way to get to the bottom line as to why we don't take care of our health. We don't. You two know it. I know it. Even if we're giving away things that their children could use for free, it wasn't enough to move them to get tested for free.
We have been actively involved with HIV and AIDS and the fight, for a number of years. And I have a daughter, and I know she wouldn't mind. She doesn't mind me saying that she's living with the virus, healthy, and so this has been one of our objectives. Now, and since we're talking, and I hope that the fact that the lines of communications are open, we know that people give to people. And I saw Melvin Wright came on earlier. But the trust factor in developing a relationship. What those tests? What do you call those things? Medicine have those. No, not that. No, when they go out and study case studies. Okay. Yeah. So trying to get Black folk involved with case studies, new medicines, from when we were kids, getting the shot, polio, and all that other stuff. But trying to get Black people involved, there's a trust factor there. Yes. And you hit on it with the Tuskegee experiment, but it goes deeper than that.
Yes.
It goes back when they were actually practicing medicines on slaves. So this is ingrained in us. So in order for us to get past that, it has to be someone who looks like us, that is knowledgeable and trustworthy. So
absolutely. I used to do a lot of interventions, not interventions, but more of classes talking about openly with women about their sexual health. And I can tell you from my history, my mother never had a conversation with me about sex other than when I started menstruation. She said, "You cannot have anything to do with any boys because at this point you can get pregnant. And if you get pregnant, we're poor. I can't support you. I'd have to put you out." And I thought as an adult, What a harsh thing to say to a 13-year-old girl. So it led me to ask her later on, did your mother ever talk to you about your sexual health? She said no. And then I believe my grandmother's mother didn't talk to her either. We don't talk to our children about their sexual health at all. So if you really want to go deep, dive deep there as to what is going on within us, a black person, man and woman. These are, as the Jamaicans say, your pick me. It is your responsibility before they leave the house to educate them. What is going on that you won't do it? Is it fear that you have to talking about? One lady said, but I have HIV and I'm not talking to my daughter. I says, I didn't ask you to tell your daughter you had HIV. I asked you to have a conversation with your daughter about her sexual health. She was nervous and scared and said, I don't think I can do that. And I said to her, you're HIV positive already. You have to do that. You're more educated than anybody because you're already positive. But to break down that barrier, that's a wall that is so tall. And we do this. We see no evil, we hear no evil, and we speak no evil to our own children. And you want us to go out in the community and do it? Really? How? We have to start a conversation on your show. Start a conversation. Dare parents to have a conversation with their teenagers who are consistently getting pregnant. What is the parent doing? See no evil? Absolutely. It continues.
Mhm. I see that Melvin Wright is still with us. Melvin, and you know, excuse me, Miss King, I'm sure, do you know Melvin Wright?
I don't think so. Does Melvin Wright know me?
Uh, Melvin, Melvin, you heard it, right? Put it in the chat box, Melvin. Melvin has been again on the forefront of this HIV and AIDS fight. His mantra, his slogan is "We are in this together."
Yes.
And Melvin has started. Well, he started at HIV/AIDS club at Deerfield High School. He was in the article with the Westside Gazette as well. Melvin is, what does Melvin say? Melvin said, "No, I don't know her." So
To know you, sir.
you two need to, yeah. So, but okay. Now, um, we were talking about. Oh, now I can see the chat. Okay, we were talking about COVID.
Yes.
Uh, yeah,
So let's go there with COVID. Miss Jennifer, I've gotten 100 calls. Miss Jennifer, should I take the COVID vaccine? You know, they're giving it to us. They're going to kill us. Um, God forbid when Colin Powell passed away, my phone blew up. He would be black and die from COVID after being vaccinated. But I'll go even further with Jesse Jackson, who was vaccinated fully, but his wife refused and then she got COVID. What are we talking about here, sir? This man is a political figure who got his shots, but his wife, deep down, that fear will keep you from doing what you have to do. And I'm sure she infected Jesse, fully vaccinated. These are just truths that we look at and we just cast them aside as though they don't matter. So why wouldn't African Americans refuse to take a vaccine? That's what they're doing.
Well, you
I
you you
know.
touched on. I mean, you touched on some of the reasons as to why we don't talk about these issues. Um, is there still the external stigma attached to that may lead to that
Absolutely. Are you talking about the COVID vaccine?
no, in terms of HIV/AIDS?
I can give you an example that wasn't about HIV. I have a luxury car. I have a gentleman that I grew up with, and he has a nice car thing, what he does. He's been in and out of prison in his 20s or teens, but he runs a really nice shop. I called him the week after Mother's Day, and he said to Miss Jennifer, I'm in the hospital. I had a stroke on Mother's Day. And I said, oh my God, I'm so sorry. And I said, can I do a quick prayer? And I prayed over him. And you know what he said? He said, when I got out of prison, I'd never seen a doctor. I'm not going to any doctor for any reason. People don't go to the doctor, period. Let's not even about HIV. That's probably the least of their worries. They don't go. They could be urinating all night long, which is a sign of diabetes, or you can have a sweet odor to your breath, which is diabetes, or they having pain in their prostate and they're peeing all night, which is a enlarged prostate that can lead to prostate cancer. Should I go on and on? Or they can feel a lump in their breast, but fear is what's driving all of it. And we don't go and see about it. I had a coworker tell me today that he was fearful to go to the dentist. Fearful to go to the dentist because it's going to hurt. And I explained to him they're finding out now that your dental health is directly related to your heart health. Because anything that goes on with your teeth could easily lodge on your heart and cause a heart problem. I find myself educating, throwing out myths, dispelling myths one by one. People don't read. They get their news from Facebook. I'm sorry, I'm glad you're on Facebook because this is real good news. But I think the bottom line, as a nurse for 34 years, is fear. It's huge.
This is indeed a conversation that needs to continue,
Yeah.
and we need to have an open conversation. I know
Open
there
dialogue.
open
Absolutely.
dialogue. Yeah.
Yes, we do.
Yeah. And the fact that you mentioned false evidence appearing real,
That's what
fear,
fear is, sir.
fear, you know, and true that is something that we can't see that would kill us, you know.
Right. But you're
Uh,
coming from a spiritual standpoint of view. And as a clinician, I have to come from whatever standpoint of view they have and work with that to build
mhm.
them up mentally, to even think about coming into care for just your own care, not just for HIV or maybe you'll get COVID. We have to start where the patient is, whoever they is. They could be your friends who you know have never gone to see a doctor, or you know they suffer from high blood pressure, and you see them, doing the things that probably can make it worse. And so we're just waiting for the shoe to drop. The next thing you know, like my guy who washes my car, he had a massive stroke. And I prayed about that to let him know I am grateful that you didn't die. So let's just look at the things that are good happening here. That you answered the phone in the hospital. And God has equipped me with the ability to go there. Let's go to the lowest point and make it look good. You answered your phone in a hospital and you've already charged the people in your family, your brothers, to go and still run that van and come and wash my car. I mean, there's hope. We just have to go at it, open up our mouths and talk. We know, you both know, your
Yeah.
listeners know when something is going on with a friend, a coworker, a lover, it doesn't matter. Have the conversation with them and see if they'll just talk about it. If they talk about it, they'll work on it. If they have a listening ear.
Let me ask you this, Ms. King.
Yes.
And I know Ebony didn't make it. Okay, now, are there, we are in conversation throughout this and other of our programs about voting. What legislation, if any, is coming up that you know of, or that you might know of, that we need to be aware of, that we need to get out and vote on?
I'm not political, but I vote in every election, midterms and everything. But I'm not political. I don't know the gentleman you had on, but I bet you he knows one of my church members who works in the state's attorney's office in Miami. She's a Haitian woman as well. Um, so I cannot answer that. I would say that we just need to advocate that our people, that they are registered to vote. Some people just feel such, they're food insecure. They don't have money. They don't care about a vote because they're losing housing, or the housing prices have gone up, and right now gas is high. So poor people historically don't really care about going to vote, less more being a registered voter. They're not registered to even vote. So I think if we can be a Stacey Abrams and get the word out to vote, to be registered to vote. I don't know how we can become like her, but she's my rock star, if nothing else. If we just can get people to understand how important, and my church is pushing it. I've heard people in the community pushing it. I hear you all pushing it. It is very important that every African American on this planet who can vote get registered to vote.
And I ask you that
I
question.
think the last president showed us just
Mhm.
what can happen when you miss the opportunity to vote.
There is legislation concerning HIV and AIDS. Well, that population, as it pertains to drugs, housing, the works. So it is paramount. The food prices, the gas, that we do understand a reason to vote. So I agree with you. We got to get everybody to vote.
Exactly.
Mr. Busby?
That's right.
Mm-hmm.
Well, it looked like we did a good job with Obama, huh?
Uh-huh.
What was that all about? Because he got the same color skin?
Hey, now you gonna create a firestorm here, Miss Jennifer.
I want to create a firestorm. I want to know,
Right
why
on.
did you vote for him?
Right on. Right on. Yeah. So there is a need for us to continue to what it is it's a right. Yeah, it's a right. Yeah.
It is all right. Yes,
Right.
absolutely.
It's a
Because
right.
at one time, if you couldn't tell them how many jelly beans was in the jar, you wasn't going to vote.
Right.
Yeah.
Be careful now. They don't want you to teach that history.
I'm like the judge now. I'm in.
Uh-oh.
My middle name now has become advocate.
Okay.
Advocate. It ain't nothing about HIV. Advocate for every soul that calls my phone, asks me to do what you just did with that newspaper, and I want to know how I can get one. Thank you.
Okay.
Uh, my job said to me on Tuesday, the day after 4th of July, or Wednesday, Ebony said, "You've been nominated to go on the Westside Gazette." And I kept thinking, is that Mr. Henry's newspaper? We were talking way back years. I've kind of thought about it. And so I just did what I was told because I knew it was the right thing to do. As the judge said, we just have to do the right thing, not sometimes, but all the time, because we are the souls pushed forward to get it done. We are the ones carrying the light, and we have to do it. We have no choice,
Okay, well that was
including you, sir, with your newspaper of 97 years.
okay, right. Yeah, we've been around now. I gotta get, but not 97 just yet. But no,
Okay.
that was a good closing point there, Miss King. Is there anything else you want to add before we as we close
How
out?
can I get a newspaper?
We'll make sure you get it.
Thank you.
If you would, oh, I need to get your phone number. I'll call you, then I'll get your address.
Okay.
I could.
You want me to give it to you again?
You want to do it now?
The phone number, you want me to give it to you again?
Yes, please. I think Ariel may have. Yes, please.
954
Mm-hmm.
415
Okay.
8687.
Okay. All right. The last time we talked, Miss King, you were about to give me your cell number. So I will call this number to get your cell number. So I have you. I got you.
This is a cell phone too. It just happens to belong to my job.
Okay, I got you. I got you.
All
I got
right.
you. Again, Ms. King, thank you so very much. Now, is there one other closing thought? Then we're going to do you. We'll go to Perry, and then I'll close us out.
I just want to thank you, sir, for what you do for the community for a long time. And if we can just stay in the fight really is us teaching and helping each other in a circular, loving, compassionate way, as the judge said. I agree with everything he said. We just have to keep going. And I thank you for having me on.
Okay. Mr. Busby?
And thank you, Ms. King, for this dialogue. Everything that you said was on point. And we can't understate enough the fact of what you said, and that is that we really do not give much attention to those things that are most important to us. You talk about health. We can say the same thing about voting. We can say the same thing really about our communities. Our communities are a reflection of that same poor health and the lack of transferring that knowledge down through the generations. You're exactly right, and these are, I agree. It's time we have these discussions openly and forthrightly.
Yes.
If we're going to move ahead. And so I appreciate you for not beating around the bush about saying it exactly. And I know, as being a Black man, you know, I used to hear Tom Joyner make a campaign about it. And unfortunately, about take a loved one to the doctor, and especially our Black men. COVID has, I've lost plenty friends, male friends in this. And so thank you so much for your wisdom and for sharing with us tonight.
You're welcome.
Okay. And we have several comments from our viewers. Ms. Rose Rita says, I enjoy listening to Ms. King. I can see how she has a tremendous impact on the community. And David Wright says, thank you, Ms. King. And in the words of Melvin Wright, Melvin's slogan is, we are in this fight together.
Yes.
So if we are to win or to achieve accomplishments, we have to realize that we cannot do it alone. Man does not live by bread alone, nor does man accomplish anything alone. And that's man and woman. I'm not being a chauvinist. I do include, I should say, life. When I say man, I'll do it as man and woman. Also, our next week's show, we're having Nikki Freed, who is a candidate for governor, and
Current agriculture commissioner.
the agriculture commissioner, and a special guest with a special announcement, Miss Dr. Nadine Hankerson. So we should have a very, very entertaining show, and we'll ask that everyone join us and be prepared to submit your questions. And before we leave the air, I want to say, through it all, had it not been for the grace of God, nobody would be here. So giving honor first to him who made it possible for all this to happen. To God be the glory. I love you, and there ain't a doggone thing you can do.
Oh, you sound like Chico the Virgo.
Oh, no.
Oh, Chico gonna love that one.
You know,
Chico gonna love that one.
oh, 6
Oh,
foot folk
stay in touch.
Afro who's on the radio. This is about it. Good night, all, and God bless.
Good night.